name is Dr. Wee Lai Hock. I'm a consultant orthopedic surgeon at Island Orthopaedic Consultants. My subspecialty interest is foot and ankle surgery. Today I'm going to talk about ankle sprains. Ankle sprains is the most common soft tissue injuries in humans. Typically, the ankle sprain is a twisting injury of the ankle, and usually the ankle inverts this way. The two ligaments that often get injured are the ones at the side here, on the outer side of the ankle, the anterior talofibular ligament and the calcaneofibular ligament here. Ankle sprains can often be treated quite easily with the RICE protocol, which means rest, ice, compression and elevation. Obviously there's going to be a lot of swelling and pain around the area, and the RICE protocol is an effective method in treating ankle sprains. 90% of ankle sprains are treated this way, but a small percentage of ankle sprains do often run into trouble. And the patients who have prolonged or chronic symptoms from ankle sprains are usually seen by a person like myself, and they are evaluated carefully for other possible causes of the pain rather than a ligament injury. The other possible causes would be things like an undiagnosed or missed fracture or a cartilage injury. And if those conditions are suspected, MRI scan is often ordered to rule those out. In patients who have chronic symptoms or instability of the ankle, a course of physiotherapy is often very useful in terms of treating the patient so as to allow the patient to return back to her normal daily activities. However, there's also a group of patients that do not recover in spite of conservative or non-surgical treatment, for example, rest plus physiotherapy. And in those patients, we will assess them for surgery. And surgery for ankle instability would involve reconstructing the ligaments which were torn previously and now have become lax or loose. And in this group of patients, the patients would typically complain of pain and instability, especially when they walk on uneven ground or when they are engaging in sports that requires them to turn and twist very quickly, for example, football, basketball or tennis. The recovery from the surgery is usually quite good, and the patients are typically back to playing sports in 6 months. The main choice of my surgical treatment would be a modified Bostrom and Evans procedure. In this procedure, what we are doing is we are tightening up the ligaments at the front here, and with the other ligament we are going to use a tendon graft to basically augment or to strengthen up that area, and therefore the whole reconstructed procedure gives rise to a very stable ankle, and the patients are usually quite happy with that stability. So as mentioned earlier, cartilage injuries are picked up on MRI scans. So if there's a cartilage injury of the ankle, the treatment is nearly always surgical. The way in which we treat cartilage injuries would be to debride or remove the loose cartilage pieces, plus doing procedures which will allow the cartilage defect to regenerate itself. The mainstay of this sort of procedure would be the microfracture procedure, which means is we punch holes into the bone to allow blood to form over the cartilage defect area, and therefore when the blood clot forms on the area, it will then change or modify itself into a tissue called fibrocartilage, which will resurface the cartilage defect. Ankle sprains usually heal well within 6 weeks with rest and some simple bracing or support. However, if it does not heal within that time, I would recommend an MRI scan. An MRI scan looks like this, and what it does is that it looks at the whole ankle joint. In the MRI, we can look at injuries of the cartilage, the ligaments, and even the bone. So even missed fractures can be seen on the MRI scan. And in this view, okay, what we are seeing is the slices or cuts of the ankle joint, and this is a normal ankle joint with a normal cartilage, which is this thin black line as you see here. So if that is seen on the MRI scan, therefore we will assume that the cartilage is normal. Lastly, I would like to talk about ankle impingement following an ankle sprain. Ankle impingement is a painful episode following an ankle sprain, and usually occurs about 4 to 5 weeks after an ankle sprain. Patients usually do not have any instability, but they will have pain when they kneel, squat, or climb stairs. The cause of the ankle impingement is a thickened ligament. When the ligament that is torn heals, the ligament occasionally gets thicker and thicker, and therefore when the ankle joint moves, the shin bone and the ankle bone catches the thick ligament within the ankle joint, thereby causing the pain. Treatment for ankle impingement is quite straightforward. The surgery can be done under keyhole procedure, a keyhole procedure, and the thickened ligament is debrided or trimmed down so that there is a thinner ligament which would not cause impingement.